Good morning and welcome to the presentation on reducing stigma and changing attitudes around opioid use disorders or OUD. Let's share what we know.
According to the CDC's National Center for Health Statistics, there were more than 100,000 drug overdose deaths in the United States from April 2020 to April 2021, an increase of 28.5% during the same time period the year before. Yet only 23% of hospitals have an opioid stewardship program.
Opioid use disorder and overdose deaths continue at epidemic proportions. Opioid overdose deaths are higher than deaths from HIV, car crashes, or gun violence.
Among the public and professionals, there are widespread high levels of stigma towards patients with opioid use disorder and using medications to treat this disorder.
Treating addiction is no different from treating any other chronic condition, such as diabetes or asthma.
When persons with an addiction disorder are approached by providers with disdain and rejection, no matter how subtle, they may reject the care offered because of the provider's attitudes toward them. These negative behaviors may result in a missed opportunity to help the individual. Also, patients with OUD are among the highest users of health care. However, during hospitalization, addiction-specific interventions remain underutilized.
Incorporating harm reduction strategies and evidence-based interventions in working with persons with addiction yields the best opportunity for helping them get the care and treatment they need. While addiction has historically been viewed as a moral failing, it is now recognized and treated as a chronic condition and is treatable.
Health providers may think that OUD can be controlled by the user and that other healthcare conditions the person has is caused by that drug use. This may not be true. Providers may assume that OUD patients are prone to refuse treatment, could look unkempt and unhealthy, may be out of control and have violent outbursts. This also may not be true.
Is this true? Are OUD patients always going to be unmotivated and out of control?
Despite the many misconceptions about patients with addiction who enter into recovery, patients are seeking help and are generally very motivated, engaged, appreciative, and grateful. Medications are an essential tool in the treatment of all chronic illnesses, including alcohol and other substance use disorders. For opioid use disorders, 3 medications are currently approved by the FDA: methadone, buprenorphine/naloxone, Suboxone, and injectable naltrexone, Vivitrol. Each has proven to be effective. Providers may think that prescribing medication to OUD patients will cause them to substitute one addiction for another.
Is this true? Will OUD patients substitute one addiction for another? This is scientifically inaccurate and undermines effective OUD treatment. These medications are designed to treat symptoms of addiction, such as cravings and withdrawal, without leading to compulsive illicit opioid use or euphoria. All patients should be offered the option of medication. It is the most effective treatment for OUD patients, with or without therapy. Providers need to meet patients where they are at, even if there is no robust behavioral health program at their facility. Behavioral therapy on its own has a 90% failure rate, so medication is needed. Detox without medication also poses a very high risk of overdose and death. Providers may think that prescribing medication to OUD patients will cause them to divert and misuse the medication that they are given. This may not be true.
Sometimes it is. However, most data suggest that the majority of buprenorphine and methadone misuse, without a prescription, is for the purpose of controlling withdrawal and cravings for other opioids and not to get high. Methadone and buprenorphine together make up as little as 15% of diversion reports, while oxycodone and hydrocodone are responsible for 67%.
These implicit biases can contribute to negative attitudes toward treatment. Medication has been shown to be the most effective way to treat opioid use disorder. How can health providers improve treatment? What are evidence-based approaches for OUD patients? Harm reduction aims to reduce the negative consequences of substance use and offers an alternative to abstinence as a singular goal. Incorporating harm reduction principles into primary care treatment settings can engage patients with ongoing substance use and facilitate the delivery of evidence-based screening and prevention services. Families need to be trained on naloxone to prevent overdose deaths in the case of relapse. Health providers could replace negative attitudes of their own or that they hear from other providers with evidence-based information and interventions. Healthcare providers can inform patients about their disease, such as transmission, symptoms, course of illness, treatment, and harm reduction. They can treat the whole person with health counseling and teaching. Health providers can use guided motivational interviewing to identify the problem and make goals about the future, including recommending potential local treatment options such as mutual support groups. What about behavior therapies? Being proactive by incorporating behavior therapies with medication treatment can help people stay in treatment longer.
Mental health issues are a co-occurring disorder and both need to be treated at the same time. However, this does mean that if a behavioral health program doesn't exist, medication should still be provided. Hospitalization can be used as an opportunity to engage patients in addiction treatment, which can increase the likelihood of transitioning to outpatient OUD treatment.
Health providers can give information on ways to keep loved ones safe from infection, such as wound care, overdose prevention, phlebotomy skills, sexual health, and virus prevention strategies. Persons with opioid use disorder need non-judgmental care from healthcare providers in order to help them reduce the risk of harm. The goal of using medication with opioid use disorder patients is to reduce mortality, reduce morbidity, reduce drug-related crimes, increase retention in treatment, and increase overall health. What is the purpose of using medication with patients who have opioid use disorder? The purpose is to re-establish brain pathways, which takes at least 100 days to do. It is important to control symptoms of withdrawal, suppress cravings, restore emotional responses and decision-making capabilities, decrease reactivity to stress, block effects of illicit drugs, and promote and facilitate engagement in therapy. When persons with an addiction disorder are treated with care and compassion, they are more likely to engage in long-term treatment that improves their physical and mental health. To learn more and access online training and mentoring for the treatment of opioid use disorders, go to PCSS Providers Clinical Support System at pcssnow.org. UW-Madison offers an in-person substance use disorder boot camp for providers that occurs every 6 months throughout Wisconsin. UW-Madison also has an addiction consultation provider hotline that offers on-call help to healthcare providers seeking support and direction in treating their patients' substance use problems.